Okay, so to continue our abdominal imaging sessions, we will talk in a short, focused lecture about the radiological features of pancreatitis, which will be presented by Dr. Shaima Hassan. So,
Hi everyone. Today I'm gonna present a small seminar about radiological feature of pancreatitis. And this is the ultrasound view of them. We know the pancreas is located at the leaf blocks L1, L2. It's located on the posterior abdominal wall, except the tail, which is located within the hilum of the spleen. It's a coma-shaped organ. About the echogenicity of the pancreas is somehow iso or slightly hyper echoic regarding to the liver. That's about the anatomy of the pancreas is composed of head, neck, body, and tail. The pancreatic duct normally as a range should be less than 2 millimeter. يعني below 50 years should be less than 2 millimeter as a range. But overall should be less than 3 millimeter يعني overall any age. I mean. Pancreatitis, there's inflammation of the pancreas. Either the most common cause of the pancreatitis, what is the most common cause? Gallstone also the second most common name. Also, there's another cause of like trauma, like
autoimmune. Autoimmune.
autoimmune disease, hyperlipidemia, hyperparathyroidism, hypercalcemia also. And according to the duration, according to the duration, there's acute pancreatitis and chronic pancreatitis. Also, acute pancreatitis is subdivided to interstitial edematous and necrotizing pancreatitis. In the interstitial edematous pancreatitis, there will be swollen whole pancreas and edematous, but the pancreatic microcirculation is intact, so there will be homogeneous enhancement. But in necrotizing pancreatitis, there will be disruption of the microcirculation, so there will be non-enhancement of the necrotic part. There will be necrotic within the pancreas. Here, interstitial edematous pancreatitis is also subdivided into if there's acute stage, there will be acute pancreatic fluid collection only. If more than 4 weeks, according to this classification, revised Atlanta classification, if more than 4 weeks, this fluid is called pseudocyst. The necrotizing pancreatitis, if there's less than 4 weeks, it's acute necrotic collection. If more than 4 weeks, walled off necrosis, name it. Radiology. The X-ray, plain abdominal and chest X-ray findings of pancreatitis. On the chest X-ray, there will be left side. Next slide. Left side abdominal X-ray. There will be sentinel loop, only dilated bowel loop. This is one of the features of the pancreatitis. Or colon cutoff sign. There will be abrupt ended colon at the spleen flexure, colon cutoff sign. Also, there will be obliterated psoas muscle on the left side, or displaced kidney on the left side. These are all X-ray findings of the pancreatitis. Also, chest X-ray finding, there will be left side pleural effusion, basal atelectasis, elevated left hemidiaphragm or edema. All are signs. About the ultrasound finding, on ultrasound pancreatitis, there will be, according to the which type is it, decreased echogenicity, and there will be edematous. Sometimes the cause will be seen within the ultrasound, like a gallstone or complication with the vein, thrombosis, or necrotic area we can't see. Increase the pancreatic volume, increase echogenicity, or pressing on the other adjacent organs. Here we have pancreatitis with peripancreatic fluid effusion, peripancreatic fluid collection. Here pancreas is inhomogeneous, swollen inhomogeneous, and there will be fluid anterior to the pancreas. Same inhomogeneous pancreas. Same edema, fusion around the pancreas. Interstitial edematous pancreatitis in 50 years old man, alcoholic abuse. Here, enlargement of the pancreas and decreased echogenicity of the pancreas. CT finding also there will be maybe there's a focal change, maybe focal pancreatitis. In the second pancreatic margin, there will be fat stranding or edema around the pancreas. Maybe there's a complications like calcification, cirrhosis, pseudoaneurysm, hemorrhage, abscess can be also seen in the CT. Here, pancreas showing homogeneous enhancement of pancreas, which also
Surrounding of the surrounding fat layer.
around the pancreas.
Some effusion you can see here around the body and tail of the pancreas. And there is something here, maybe a stone, maybe calcification, I don't know.
This is another view. Acute necrotic pancreatitis. There's in this view, in the soft tissue window, you can't see any changes, but in the liver window, we can see decreased enhancement at the head, body to normal enhanced tail. So at the structure, so it's focal pancreatitis, not generalized pancreatitis. Here, acute interstitial edematous and necrotizing pancreatitis, CT scan both of them. We can see there's ill-defined margin of the pancreas, and there will be edematous fat stranding around the pancreas. Also, in the necrotizing, also there's ill-defined pancreas, and there will be fat around the pancreas and edema around the pancreas. Okay, MRI is beneficial. Non-contrast MRI is superior to the non-contrast CT. Especially on this patient, we can use iodine contrast media. Pancreatic edema and hemorrhage are best can be seen on T1 and T2 for internal content of peripancreatic fluid collection. Okay, this is MRI T2 and this T1. You can see increased signal intensity.
Okay.
The second one decreased, and it's heterogeneous pancreas. Same also. It is T1, T2. It is T1, decreased signal intensity and increased signal intensity. Here, necrotizing pancreatitis, also in the T2, with fast separation exhale, so it's visible increased signal intensity. Here, the hepatic arterial dominant and the hepatic venous dominant here.
So these are T1, fat saturated post-contrast, showing
here no enhancement, and after hepatic arterial, strong enhancement here. Chronic pancreatitis, on the plain abdominal film, maybe we can see calcification within the plain abdominal X-ray at the level of L1, L2, or ultrasound we can see atrophy or increased echogenicity of the pancreas, fibrosis, calcification, cirrhosis, pseudoaneurysm, thrombosis, ascites also we can see. It is typical changes of chronic pancreatitis on ultrasound, which is we can see dilated pancreatic duct. There is calcification, intrapancreatic calcification, and there's a large cirrhosis here. all features of chronic pancreatitis are the same view. CT طبعا for used for advanced disease and for complications of chronic pancreatitis. Changing this طبعا chronic pancreatitis at the beginning طبعا mild at the mild will not change in the size. In the moderate may increase in the size of the organ. In the severe chronic pancreatitis, they will be decreased in the size of pancreas. Here, chronic pancreatitis CT axial كان without contrast.
هو مو without هو delayed phase هذا الكلمة بها excretion. It's delayed phase post contrast. Anyway.
Okay. Axial section of alcohol abuse patients showing dense diffuse calcification of the pancreas. This is anastomosis of direct pancreatic duct with the jejunal vein. Like mimicking يعني pancreatic cyst like that. Pancreatic cyst or pancreatic mass. Which is not a mass. Here we can see one segment of the pancreas, which is there's calcification of one segment of the pancreas, which is a focal pancreatitis, not diffuse and not generalized pancreatitis. It's focal pancreatitis. Here showing a CT scan, contrast enhancement, multiple cirrhosis within the pancreas, and yes, there's multiple cirrhosis. We said that MRI is very sensitive for diagnosis of the chronic pancreatitis. You can see loss of acinar cell, ductal changes, which is you can see decreased signal intensity on T1 and increased signal intensity on T2. Here, one should be this is the balance. It should be this decreased signal intensity at T1. Here hepatic arterial and hepatic venous phase MRI طبعا both of them hepatic arterial phase and venous phase. You can see the tails enhanced here, tail and body enhanced with the contrast, but at the venous phase it's mild and increased enhancement more than that of arterial phase.
So
they are enhanced more at venous phase. That's it.
Thank you.